Well, good afternoon, everyone. I'm Sean Egan here again with another installment of our COVID-19 workplace safety FAQ sessions. I think this is our fourth week. We are moving forward pretty well. I appreciate everybody that's tuned in. If you have been tuning in, I know you're getting sick of my intro, but we're going to keep it going. One of the things we focus on here at the Department of Labor and Economic Opportunity that I always want to frame for everyone as they're thinking about all of these rules and regulations and things we're trying to do. The goal here is to get open and stay open, and doing that with the challenge of COVID certainly is hard. So as I always mention, we really want to focus in on some of the things that have remained static throughout this crisis on how COVID spreads. Certainly, as we all have been hearing and we should know, social distance, good hygiene, and facial coverings are sort of the key to us getting those numbers down and keeping them down. And that means that, as some of the science is telling us, 40% plus of the people that are spreading this thing are either asymptomatic, meaning they'll never get sick, or they're pre-symptomatic, meaning they feel fine. So for any of us, when we're out and about and we feel fine, we're probably not going to be too motivated to wear the face covering. And that's why it's absolutely critical that you keep that in mind in everything that you do. Social distancing by far is a primary tool to contain the spread of COVID. The facial coverings, when we cannot maintain that 6 feet of social distance, either outside or anytime we're indoors in an enclosed public space. And it primarily spreads through large respiratory droplets. And we create those when we talk, when we laugh, when we sing, when we sneeze, when we cough, you name it. We are expelling these large respiratory droplets, and that's why that social distance and face mask is so required. You can find some great tools and videos regarding this over at Mask Up at Michigan.gov Mask Up. That's part of the Mask Up Michigan program that you've been seeing on social media and commercials. And what we're doing in the workplace safety area is continuing to coordinate across agencies and developing communications and other tools to make sure that we all know the things that we need to be doing and thinking about when we return to the workplace or when we're doing other things in our daily lives. Again, if you go over to Michigan.gov, COVID Workplace Safety, the comms team, as well as MIOSHA, have created great tools for all of us to take a look at and use. These include guidelines created by MIOSHA for every industry that's been named in an executive order. There are general industry guidelines for those industries that are not specifically mentioned, which will apply to you also. We have great posters, videos, fact sheets, and more over there, including social media tools and videos for you to check out. And we have links to a lot of other information there as well. Here are just a few examples of the posters, and we have more that are specific to certain types of industries. For anybody, an employer or an employee that has questions regarding COVID and workplace safety, the MIOSHA team early on in the crisis created a great hotline at 855-SAFE-C19 for you to call in directly to MIOSHA with those questions. The average wait time is about 15 seconds. The average call is about 5 minutes. If you're an employer and it's necessary, they can work with you and get you over to their consultation team. They have a great consultation team that works with employers to help them implement the things to make their workplace more safe. If you're an employee and it's necessary, they will get you over to the process of filing a complaint to enforce some of these workplace safety standards. There's some other great websites there, including for businesses, the Michigan Economic Development Corporation Peer Michigan Business Connect. That is a platform with Michigan manufacturers that provide PPE. That includes barriers, hand sanitizer, facial coverings, and other things. Employers can also go to the My Symptoms app, which was created by the Department of Health and Human Services and the University of Michigan to do that health screening portion of coming to work that you're required to do under the executive order. The greatest tool that we have for workplace safety is always to eliminate the hazard to the maximum extent possible. The health screening is required because it eliminates that potential hazard from the workplace to the best of our ability. So you absolutely need to be doing that every day. This app will help you get through that. Only caveat is for manufacturing and meat packaging plants, there is a temperature component that must go with it. For others, this will still cover the questionnaire portion of the health screening, and for other industries, it'll cover the health screening portion. You can also find great information at the Michigan Safe Start. That's the stages of reopening, and there's great maps and other tools there, as well as I mentioned, the Mask Up Michigan campaign. So with that intro, we will get over to the Q&A period.
Sorry about that, I'm having trouble with my mute. Hello everyone, my name is Erica, and I am going to join Sean here to go through and read the Q&A that you are all submitting. If you haven't already, there's a Q&A function in Teams here, and you can go ahead and submit your questions and we'll get to as many as we can. So with that, I will read off the first one for Sean. I know someone who works at a packaging company in Warren, Michigan, and the owner has done nothing to protect his employees. What can be done about this that is not right, and I don't know what to tell him or who needs to contact about this issue. It looks like ever since the lockdown, she's stating that there haven't been any precautions for COVID-19 at this packing company, no masks, no social distancing. So Sean, what do you recommend this person tells their friend, or how can we help them?
Absolutely, and I'm sorry to hear that. I think that as we work with businesses around the state, we see a lot of businesses doing a lot of things, but we know that these things are happening. As you can imagine, we don't have unlimited resources to go to each and every single location routinely to make sure that those things are happening. So we rely on employees to engage in the rights that they have and the protections that they have, and go to that MIOSHA website and file a complaint. You can do that online. You can keep yourself anonymous. It's going to ask you for your name and other information so that the investigator can talk with you, but you can check a box that says do not disclose my information, and your employer will not know who filed the complaint. Certainly you can disclose your information if you're not concerned with your employer knowing who filed the complaint, but it's critical that if you're in those situations, you go over to MIOSHA and you file a complaint. You can also start with that hotline at 855-SAFE-C19. that worker can, to talk about what's happening in their workplace. And as I mentioned, if it's necessary, they will get them over to the complaint process also.
Perfect. And our next question asks, is it mandatory or a state requirement that employees' temperature be checked when they enter the building to ensure a safe working environment?
In certain workplaces that I mentioned in the intro, the executive order lists out, it's Executive Order 161, and that's tied to a lot of all of the guidelines that we have on that COVID Workplace Safety website. It details what different industries must do in their type of workplace. And the two industries specifically listed for a temperature check to come in are manufacturing and meat packaging and processing facilities. In many of the other industries, it's if possible. I would encourage employers to consider it to the maximum extent it's possible for them to do that. But those are the only two industries specifically named with a temperature screening requirement.
Perfect. All right. In an office setting in shared spaces, can an employee with a medical condition wear a face shield instead of a face covering?
This is an important question, and one we get quite regularly. So one of the things that needs to happen if you are medically unable to wear a face covering, you need to request a reasonable accommodation from your employer. That's a right provided to you by the Americans with Disabilities Act. And then you and your employer will engage in the process of finding alternatives to that requirement. I can't say for sure that yes, a face shield will work. Depending on your situation, it may. But the employer needs to evaluate a couple of things. And one of those is that it doesn't create an additional hazard for you, and that it's not creating an additional hazard for those that work around you. So as we talked with regarding COVID, those facial coverings are so critical because they actually contain, when we cover our nose, mouth, and chin, they contain those respiratory droplets I mentioned very, very close to our face. When we use a face shield, we do get some protection, but as we all know, a face shield doesn't wrap around the same way that a face covering does. So you could still actually be getting those respiratory droplets and aerosols well beyond that face shield. So if you're in very tight quarters, that might not work, but your employer may be able to move where you are. They might be able to realign some of your work. There are other things. It doesn't just need to be a face covering or a shield. There are other things that they could look at as well.
All right, thank you. This one is from Tammy. Tammy says, our biggest issue is when someone has tested positive, and when should we allow them to come back to work? We try to follow CDC guidelines, but some employees do not want employees back to work unless they test negative. We started out requiring a negative test, but now have followed CDC guidelines and use that time-based requirement.
Yeah, that's the requirement in the executive orders as well, is to follow the CDC guidelines. I think that's a great question, recognizing that the CDC recently updated how they're handling return to work and isolation and quarantine. I want to make a distinction here for anybody listening that's going to watch this. They have different requirements for healthcare professionals from everybody else. So for everybody else, they have kind of gotten past the testing protocols that we kind of were getting familiar with early on, and have moved to a 10-day, 24 hours with no fever, without medications, and your symptoms have improved.
All right, and the next question asks, are employers required to quarantine employees who engage in personal out-of-state travel, for example, a vacation?
This is a very challenging question. I know it comes up quite often. There is no perfect line that I can point you to that says what you have to do, but I would encourage employers to consider as part of their health screening protocol. It's not required that you ask that question on where have you been, but you could certainly ask the question and then use your best judgment when you're dealing with that. Certainly, if you go to a very high COVID area for your vacation, that's something that the employers going to want to consider. And I recognize that depending on the type of employment, that person being able to be remote or something could be more challenging. So it does create some challenges, but always keep in mind that, as I mentioned, 40% plus asymptomatic or pre-symptomatic, spreading this virus around is very contagious, even if they're not getting symptoms. And that person coming back into your workplace could potentially shut down your workplace. So you definitely want to take that into consideration for both your business as well as the health of your employees that are there.
All right, we have another question about travel, but this is more related to that pre-screening tool. So they said, on the pre-screening tool, do we still need to ask about recent international travel?
So you can include that. The CDC has a guide form that you can use in our health screening questionnaires. Currently, like on the My Symptoms app, we're not asking about travel, but some say domestic, some say international. So you want to use your best judgment there, just recognizing that, airplanes, getting to those hot spots and those other things, can create a potential risk.
All right, and the next one, are face masks required during in-person meetings in offices if social distancing is in place?
Yes, this is a bit of a heightened standard for face coverings in the office setting. It certainly says in common areas and hallways when you cannot maintain social distance, and it includes in-person meetings.
All right, and now we're going to talk about plexiglass a little bit. If someone is closer than 6 feet but separated by a plexiglass barrier, does the 6-foot rule apply?
So we still want to try to contain those respiratory droplets, but depending on your type of workplace, if you're in a public space like a retail or something, the executive order on masking now requires that if you're an individual within an enclosed public space, you need to be wearing the mask. That's going to apply to employees as well. In some of those other workplaces where you're installing physical barriers, our goal there is to prevent the spread of the droplets, and that may satisfy the requirement.
All right. And is there a template that can be provided to record employees' answers to daily self-screening questions?
You can find a couple. There is one actually on the CDC website on a potential health screening form that you can use. What I would really recommend is if you're not using an electronic tool, to go to the My Symptoms app and really consider using that. An employer sets that up. They'll get a unique code for you as the employer that you share with your employees. Then it's just either on their smartphone, they can use a desktop computer, a tablet, whatever, and do the questions themselves. You get a report of that. They're opening up a portal for real-time access. So it's a great tool that you can use.
All right. And what if an employee's spouse tests positive but is not symptomatic? What should we do before allowing that employee back to work?
They should go through the CDC protocols on duration, recognizing that they're in close contact. That's one of the things in the executive order and our guidelines that we talk about quite often. Close contact is within 6 feet for 15 minutes or more. If you're living with someone, your spouse, certainly you're going to be in close contact regularly. That person you're going to want to have follow that isolation period.
All right. Anthony has a next question here. Our front office is closed to the public. Our staff cubicle walls go 3/4 to the ceiling, and spacing of work areas are greater than 6 feet apart, some even 12 feet from anyone else. Do they need to wear masks at all times when sitting at their desk, as it is all in the same room?
No, not likely. In the office setting, it's when you're in those restrooms, common areas, hallways, in-person meetings, when you can maintain that social distancing, it's not required. This question came up a couple weeks ago, and I thought of it afterward. Always keep in mind that an employer can go above these standards. I had been hearing from some employers that they're requiring face coverings at all times for a myriad of reasons. We are looking forward though, and we don't have any specific requirements around this, but as we're all indoors, the science is kind of indicating that indoor, because the aerosols can hang around, can become can become a greater hazard, and we need to be thinking about that too. So while you may be able to space, you may be able to do things as long as you can maintain that social distancing. Currently, you're not going to need to wear that mask at all times. You need to have it with you when you get up and go to the bathroom and put it on. But just think about being indoors too.
All right. Under the governor's orders to work remotely if possible, is that for everyone? I work for an ISD and we're being called back to the office, but the majority of us are able to work remotely and have been since mid-August. We are now being told we have been considered essential from the beginning of the stay home, stay safe. It seems our organization is using certain rules to fit any time it works best for them.
I would say two things there. One is that the updated Order 161 changed the should work remotely to must work remotely to the maximum extent possible for workers in region other than the northern 6 and 8 regions. So 1 through 7 minus 6. It now says that they must continue to work remotely to the maximum extent possible instead of should. And I would encourage that person to give that number a call and talk through their specific situation. When we answer these questions, sometimes they're quite detailed to my workplace, and we try to give good answers. But as you start working through those, it's very helpful to talk directly with those MyOSHA folks at 855-SAFE-C19.
Perfect. And this one is specific to manufacturers. Are manufacturers required to check temperatures?
Yes. Yep. That's one of the 2 industries clearly named in the executive orders that require a temperature screening.
All right. And if an employer is notified that an employee in the building where you work has tested positive for COVID-19 and you may have been exposed, what are they to do regarding you? So I think they're asking, what is the employer required to do in terms of notifying or otherwise for the employees?
So employers have to do contact tracing within the workplace. That's why these logs and screenings are important as well, to know who was where and when. They will talk with the employee that has symptoms or has COVID through a positive test about where they were working and who they were with. They need to close off that area and do cleaning and all the other things that are necessary, as well as discuss with those possibly exposed employees how long they were exposed, what kind of interaction they had. Remember that close contact is defined as within 6 feet or less for 15 minutes or more. So I know that we are all very concerned about COVID, and we're nervous about those interactions where we just kind of pass each other and it turns out that person had it. But when they're looking at that contact tracing, they're really looking for that period of time or longer.
Yeah, and this next question touches on those nervous feelings. We've got a question that says, if an employee answers yes to a question, such as a runny nose and headache, but states they have allergies, can they be allowed into work? If we send them home and they take a Benadryl or cold pill and feel better, can they come back to work, or do we have to quarantine for 14 days?
You wouldn't necessarily have to quarantine for 14 days in a situation like that. I think that you'd want them to contact their medical provider and just make sure that you can verify that that's what it is. This is going to be a challenge, especially as we head into fall with flu season, because symptoms are very similar. I would encourage everybody, if you haven't before this year, for sure, get a flu shot because we're going to want to suppress that as much as we can because their symptoms are going to be so close. We know, and you know, that with the health screening questions and those questions, that could be other types of illnesses, but until we verify that it's not a COVID issue, we just don't know that right now. So we have to treat it like it is.
All right. And I know you've asked this one, but it looks like a number of people are still asking about masks inside cubicles. Can you just reiterate if people have to wear a mask inside while sitting at a cubicle?
Yeah, so the executive order, we're all getting quite familiar with the masking requirement that when we're in indoor public spaces. So if your building is open to the public, you're going to be wearing a mask all the time. It doesn't, it doesn't matter. If there's some separation, that may not be true. But if you're in like a lobby area and people just walk in and out, you're going to be wearing a face covering, even if you're in a cubicle. If you're in a non-public building, working in a cubicle space, or working in any office space, the executive order is going to fall to 161, and that's going to require that you wear a face covering when you are in common areas, hallways, in-person meetings, restrooms, you name it, anywhere where you could meet up with somebody else. If you are in a cubicle or in a closed office where you can maintain 6 feet of social distancing, you're not going to have to wear it all the time.
All right, this one looks like a good suggestion for our series, but we have somebody wanting to know if we can hold a Q&A session just for healthcare.
I think that would be great. I think we'll probably grab some of our great consultative team for the healthcare one, because healthcare, the challenge with healthcare, as healthcare professionals know, is they have a lot of rules around bloodborne pathogens, respirators, TB, tuberculosis, other types of pathogens and diseases that they have a whole lot of safety equipment for. So I think it would be great to have that discussion and really hone in on some of those things that they need. And I think we'll want to get someone that's concentrated in that type of space to really be available for that. And we'll be happy to do that.
All right, and how long should we store the documented temperatures from check-in associates in manufacturing facilities?
So I would recommend that you keep the log that you've done the health screening, for some time. I would not for years, but if we think about the health screenings and the temperature checks and everything else, COVID has like a 14-day sort of incubation period that everybody's relying on. So logically, it wouldn't make much sense to have it beyond that. But if you were to get a complaint that you were not performing the health screening and MIOSHA were to investigate that, that's one thing that they're going to ask for is the log. I don't know that it's necessarily going to be, what everybody scored that day, but they may ask you for a record that you've been conducting the health screening.
All right. If I have a doctor's note that says I should work remotely, can my employer refuse that request?
So that would be a request for a reasonable accommodation, and that would fall under the ADA. And there are some potential pieces on the employer side, like it creates an undue hardship, and some other things that you'd want to think through there. But so I can't say yes or no, but that's a request for a reasonable accommodation, and your employer should work with you to try to create that reasonable accommodation that will accomplish what's necessary for that condition.
Okay, and the next question is from Rhonda. She's asking, if a hearing impaired employee works in a factory setting that requires masks, but that employee relies partly on reading lips. Does the employer need to use masks that have the clear area or shields rather than masks? And are they allowed to do so per CDC guidelines? It looks like they let her use an app on her phone, but it does not translate well.
I think that is a wonderful question, and it sounds like it would be a good, reasonable accommodation for that employee. And I would encourage employers to really stretch as it relates to COVID to accommodate these types of conditions. I would note that next week, the Michigan Department of Civil Rights is hosting a webinar for employees on the ADA and reasonable accommodations as it relates to COVID. I believe it's going to kick off on Tuesday, but you can find more information on their website over at the Michigan Department of Civil Rights. And my hope is that an employer would work with you to accommodate that. How they accommodate that would be a great question for that other webinar series.
All right, thank you. Steve, Steve is asking about record keeping requirements for the health screening questionnaire. And Sean, I know you touched on like the duration, but can you talk about whether or not there needs to be an individual record for each employee? And this is not specific to manufacturing or meat packaging.
No, it wouldn't need to be necessarily. It depends on how you're doing it. So if you're doing a physical form that they're handing you, you're probably going to keep those for each individual employee. If you're using the My Symptoms app, what I recommend is an employee that's good to go will get a green screen. An employee that has flagged for symptoms would get an orange screen. Just keep a checklist if they're green or orange. But it could be all on one spreadsheet that you're checking something.
All right. And if businesses are not mandating masks, if employers are not maintaining 6 feet social distancing, should they be reported?
Absolutely, and please do. You can file a complaint with MIOSHA, and that will be investigated, and employers, it'll go through the normal process, and we absolutely need to know about that because this needs to be done well. Our goal, as I mentioned, is to get open and stay open, and the challenge with something like COVID is that a bad actor, as they call them, or somebody that's not complying, by the time that might be captured, it's usually because there's outbreaks. And if that floods into our communities, it pushes our numbers up and puts the governor and DHHS and everybody in the state of Michigan and in a very difficult position on moving forward. So as we look at colleges coming back and schools coming back, we have to all do everything we can to help keep the spread of COVID down, and these face coverings and social distancing are going to be the primary tools to do that.
All right, and do temperature screenings have to occur on site, or can an employer require employees to take their own temperature at home?
So with the two industries that are named, which are manufacturing and meat packaging, the intention is that they are with touchless thermometers or something screened as they're coming in the door. I do know that some employers where it's not required, but they're trying to do it, are asking employees to do that at home. The only thing I would caution you on is certainly if you have if you work with a labor union or you're a member of a labor union, to make sure that you bargain those issues. If you do not have a labor union, employers should know that the Fair Labor Standards Act and hours worked might be some questions there. I don't know the exact answer to that, so don't ask me that, but I just want to flag it for you as something to think about.
All right, we have time for one last question here. And again, can you just talk a little bit about family members that test positive? This anonymous question says, if an employee's family member tests positive and the employee tests negative, should we still quarantine the employee?
Yeah, I think what the concern here is that there's an incubation period with COVID. So if I take a test today, it could be negative. I could take it tomorrow, I could be positive. So if somebody is in close contact with somebody that is positive all the time until that person's recovered, it's theoretically every single day, every single moment that their symptoms or their contagion of COVID could kick in. So I think we have to really look at that in a kind of a wide lens and say, we're going to need to isolate and quarantine here because every single day that person could be bringing COVID into the workplace.
All right, we had one other question slip in here, and I want to put this one out here because I don't think it's one we've touched on yet. If an employee is required to meet with clients in a public setting, such as a court, is it the employer's responsibility to also provide masks for the client to keep their employees safe?
Technically, no, but so the employer is going to have to follow the protocols, which includes those for visitors, contractors, and others, which could be health screenings or otherwise. If you're meeting with that client and they will not wear or are not wearing a facial covering, then your employer should allow you to cancel the meeting. They should not expect nor demand that you sit there within 6 feet of social distance with somebody that in a public space where they're supposed to be wearing one. Now, keep in mind the reasonable accommodation things that we've talked about and those medically unable to wear the face covering, but you know, your employer may not be required to purchase a mask per se for that client, but I would encourage them to do it. And if they have an obligation to keep you safe, and if they don't do it and you cancel that meeting, I would not expect nor accept any type of disciplinary action for that.
All right, well, that was all of the questions that we received today, and we're out of time. So with that, any closing remarks, Sean?
Just keep in mind, when you look at all of these rules, those pieces I keep repeating over and over that you're probably all sick of hearing, how it spreads, those respiratory droplets, the 6 feet of social distancing, and the face coverings. Our goal is to get our numbers down, keep them down, contain COVID, so that we can continue to open and engage our economy and get open and stay open. If we all take our ownership in this and recognize that, you know, it's not just the restaurant where we need to be thoughtful, it's our backyard barbecue and birthday parties where we need to be thinking about this too. Because so many people can spread this that will never know they had it, we really need to keep that in mind. And as we think of the rules that way, that's really what they're intended to do, is to help us maintain that social distance, give us some protection when we can't, and make sure that we can contain COVID. So I appreciate what everybody's doing. These questions are great. We really enjoy this opportunity to engage with everybody and, you know, keep helping move Michigan forward.